Good afternoon, everyone, and thank you, sir. Thank you for the opportunity. Thank you, Rajuji, and entire Delhi team. It's been a fabulous show, and I've learned a lot of things. Um, got a little confusion in a couple of things, and what I will be presenting will be a little something new, something different. Now, this is a 72-year-old female. So this is going chronologically. She had a supra-infra tear, which was 6 to 8 weeks back. The MRI was done, and the MRI showed a tear of supra-infra, which was not advanced fatty infiltration, quite a reparable tear. For some reasons, whatever the reasons, not important, but it was conserved on physiotherapy. For 6 weeks back, the physiotherapy had started. And then she presented to me like this. This is how she presented to me with an MRI and with this clinical picture. That's it. So with the increasing severity of pain for the last 3 weeks approximately, this is the stiffness that she had, extremely painful movements. Beyond this, all the movements were limited, even the external rotation, internal rotation, there was absolutely no elevation. And she had this MR picture with her, already giving it to me that this was the tear, which was diagnosed around 6 weeks back, which was a completely reparable, nothing bad. Now, I've just put up this question because Maheshwari Sahu had made a very controversial statement a couple of months back, so I did put up this question, what will you do next? Same shoulder. So MRI was the same shoulder, and she had the MRI with her. This was the clinical picture. What will you do next? This is the question, a very basic question. I think not very appropriate for this audience, but just because I don't think Maheshwari Saab is here, but he had made a controversial statement, so I put this up. So what will you do? Cuff repair, continue rehab, injection, depot. The last one is X-ray.
Dipit, what is the passive range?
She had no passive range. She had just jog off movements. It was very painful to lift up the shoulder. Very, very painful. Now, this was the history. This is all the history had. Only physiotherapy, and she had a worsening of pain. So, now, luckily, even I wouldn't go for an X-ray. I just went for an X-ray. Okay. So, this was severity of pain last 3 weeks. Means the physiotherapy had done something, and she stopped the physiotherapy since last 3 weeks. And this is the X-ray which I just got out of pure luck because I don't know, maybe something went into me. I said, let's get an X-ray. This is the X-ray at present, at the time of presentation. So a dislocation which probably was neglected around 3 weeks. How I know 3 weeks? Only because she says she stopped the therapy because the pain was worsening since the last 3 weeks. So what do we know at this point is she had a neglected dislocation, approximately 3 weeks. You could not be sure, maybe more, but the pain worsened since last 3 weeks. And a tear which was diagnosed earlier, we all know. 6 weeks back, the tear, as far as I could see, was very well repairable. No fatty advancement. And she's 72-year-old. Now.
So, Dipit, you had no clinical implication at all for a dislocation?
So, that was the only thing. She said her physiotherapy was okay, was helping her. And suddenly, she started having pain, severe pain, and she stopped therapy.
No, but when you had an opportunity to clinically examine this patient and did not suspect a dislocation.
No, because as soon as I started lifting her up, she was very, very painful. Every movement was painful.
No, I agree. But
yeah.
If you were to go retrospective now,
yeah.
reverse engineering, what would you think were the clinical signs that you would have anticipated to see for a persistent dislocation?
No, so I did not actually palpate anteriorly. Sometimes you do get that, but except that, maybe she's very painful. This is what her attitude of the limb is. This is what she was. And this is the X-ray at the spot, at the time point, exactly at that moment. After I saw her, MRI was before.
Go back to the MRI.
Dipit.
Yes.
Dipit.
Yes.
Here.
Yeah.
Yeah. Did you think about something else, like a frozen shoulder sitting up, or something like a massive cuff tear developed afterwards? Something.
Yes. Correct.
Was it your thinking?
Could have been, the tear increased in size or anything.
The issue here is an experienced shoulder surgeon missing a clinical diagnosis of shoulder dislocation and just discovering on an X-ray. That's the point
So here,
that's being.
You can see a superior heel sacs there, probably.
this is, okay, so this is 6 weeks old. This was being treated by somebody else, like an orthopedic surgeon.
This MRI also shows the heel sacs, so probably she dislocated, got reduced, and again.
And a bigger one.
Maybe, means she dislocated earlier to this and even after this. This is what you're saying?
So that's not
Yeah, next
unusual.
one.
What
Yeah.
Shiri is saying is the massive cuff tear gets reduced in ER, goes home and redislocates. Is a typical history. But to everybody else, for a patient across the board
Yeah.
who is dislocated and who's come in and is not given history of trauma, so you don't suspect dislocation. What are the absolute clinical findings that you can suspect? What are you looking for?
If you're going towards convulsions or something?
No.
Missed.
Just clinical examination. What
there
would
was
raise
no
raise your anxiety or your
Based on anxiety, sorry. Yeah.
So, in the history,
Yeah.
So-
First, you should send to X-ray. So she did not have an X-ray. She never had an X-ray. So I sent her for an X-ray.
Dipit,
Yeah.
in the history, she never had a fall.
She never had anything. So only thing
So
she
why
had
the
was
MRI was done?
So she had aggressive therapy. That is what she said. That the physiotherapy was mobilizing her hand, manipulating her hand.
Yeah, but
something.
What was the indication of MRI? What were the symptoms at
She
that
had
time?
pain. The local orthopedic
Spontaneous
surgeon-
pain.
She had a severe pain which was being treated and was getting better, unless till there was a point then she became really worse. And that was because of very aggressive therapy. So the therapist was manipulating the hand, mobilizing, whatever, and then she stopped it. For the last around 3 weeks she had stopped it because she could not bear the pain. And then she came here.
I think something is missing in the history here.
Okay, maybe it is
Maybe
missing.
patient has not disclosed it. She must have some kind of injury, or there is a
I just
big
told you
heel
what
sacs.
I know. This is what I know. This is what the patient told me. So this is exactly what the history was, and these are the investigations. There was nothing else. Okay.
So when you clinically
Yeah.
see a full range of movement in a massive cuff tear, then you can suspect that this is a full passive. If
Yeah.
you have a full global restriction of movement, then it's a proper frozen shoulder. But if you have a disparate movement, the function of the shoulder being a ball and socket joint
Yeah.
is to have 6 degrees of freedom. So when you have a decent axial movement, I'm not saying good, where forward flexion is okay, abduction okay, but rotation is 0, then there's a mismatch there.
So
And
her
that
rotation
can
was
happen
0.
only if that joint is converted to a hinge joint, which is a dislocation, either anterior or posterior. So when you see a disproportionate restriction of rotations,
Yeah.
at the same time you have a decent forward flexion axial, then there's a mismatch. That should raise the bar. That should raise that this could be a dislocation.
So they were all movements were painful. So you cannot really judge how much would she have a passive. Means you can do a passive. I could do a little bit of passive for sure, but very painful movements. All rotations were painful. You could force it up till 90, but very painful movements. Yeah.
The rotation is predominantly restricted. So what is happening is it's a composite movement of abduction. Once the ball is out of the socket, you cannot have any meaningful rotation.
So rotations will be restricted. Her rotations were restricted, but you may say this is only 3 weeks. So rotations were restricted, painfully restricted. In a neglected dislocation status, what is true restriction? What is painful restriction? There will be some amount of pain. There will be some amount of mechanical restriction. But however, this patient was painful, extremely painful, and that is why she stopped therapy.
Let's move on.
Okay. So. Okay. So we'll go to the ARS question next.
ARS slide.
No, maybe the earlier one, the other one, the choice of treatment. Okay, so if everybody agrees, you won't do a reverse because the pair was repairable, right? You may do a closed reduction and repair, open reduction, repair, whatever. Everyone will agree for a repair, a reduction plus repair. Probably reverse is out of question. for most people, because the tear is not that bad, wouldn't like to go for a reverse or a replacement option will be too drastic, because it's only 3 weeks. It's not like a really chronic neglected. So we'll go for that ARS question, please.
But Dipit, here I would like to see the glenoid. Why
Okay.
dislocated in addition to rotator cuff, whether there is a bony banker, erosion of glenoid, that is very relevant.
I don't think there was any. The glenoid was okay. Yeah.
You did CT scan for that.
No, only MR.
So
Yeah.
even Bencart was not there?
Bankard, I don't really remember, being honest, right now.
So I think axial
Okay.
images are important here.
Okay, so we'll move on to the ARS. Next, yeah, the same question. Now, so the choice of treatment, if you're really fixed on the treatment, is finally decided, you'll do a reduction, you'll do a repair, because repair is possible and even reduction is possible. Now, which one of the following would you go for? So most of the people
fifth
are
option
going
is
for-
arthroscopy for, it should be red, I think. Arthroscopy for both reduction and cuff repair.
Correct.
Is that right? So anterolateral should be read as arthroscopy.
Right. Anyway, so I'll just move forward. So most commonly one of the two will be the choice. Either you go for deltopectoral, but the deltopectoral, the only problem will be the challenge, not a problem. The challenge will be repairing the cuff, because that is not a common approach for cuff repair. And you could go superolateral for cuff repair, but that's not a common approach for reduction of the humeral head. So both were sort of not very appealing to me. So we did this arthroscopy in beach chair position, and you see if the arthroscope is through the D portal or what I call the anterolateral D portal. And this is how. So this was only 3 weeks.
You attempted close reduction?
I did not. I did not attempt close reduction. We directly went in for the scope, put in the scope through the anterolateral portal directly inside, did a biceps stenotomy first, and I saw the humeral head and I saw the glenoid. So this is the scope inside. We will just move forward. The hand was not under traction, just free draped, and this is the humeral head. That is your glenoid. If you see, I'll just pause it here. So the humeral head is anterior-inferior, like 3 o'clock and below. The glenoid is on the left side. The humerus head is on the right side.
Dr. Dipit, we have about 2 minutes.
Yes. Okay, so then what I did was I just put a periosteal elevator from an anterior portal like that. Okay. So the approach was confirmed with the needle. I put the periosteal elevator, just a local one, whatever I had. This I took a little bit medial to the humeral head, but just embracing the humeral head and just levered it back to the glenoid. Then what I did was, after this was reduced back, I repaired the cuff through the same portals, which is the portal which I commonly use. The viewing portal is lateral, then there is anterolateral and a posterolateral, 2 more portals, and we put in an anchor medially, an anchor laterally. I mean, the cuff repair was straightforward. I don't think was any. How many minutes am I done? I'll just show you the X-ray. So this was repaired. This is at 6 months. She's pain-free, and if you see the X-ray, that's well contained at 6 months. I'll show you the X-ray. If you see very carefully, please see the X-ray at 1 year, and I'll leave you with a little fun fact which troubled me a little bit. और जैसे रमन कांत साहब ने बोला, अगर खुद परेशान हो दूसरों को भी परेशान करो. So if you see the X-ray, what is the metal thing in front? So you have an anchor there, a lateral row anchor. What is the other metal thing? I thought is something broken inside. What is there exactly? Yeah, blouse.
So